Hi guys, Dr. Randy here from Pause, Reflect, and Heal with my good friend and co-host, Olivia Sacci from the University of Arizona Vet School.
Nice to see you guys again. I still like when you call me your friend.
Oh,
It makes me happy every
You're
time.
always my friend.
You're my friend too.
Absolutely. Well, this is great. And I have to tell you, I love her helping us with these because it makes it so much fun for me. It's not just one ugly mug staring at your camera.
That is not true.
Anyway, we have a question from Jay.
Perfect. So Jay is from Los Angeles, California, and he said that his cat is recently diagnosed with kidney disease. What should Jay actually focus on first, and what treatments make the biggest difference long term?
So kidney disease in our cats can be very, very significant and definitely a progressive ongoing problem. I address it a little bit differently than other veterinarians. So I'm going to give you the integrative perspective, not just the allopathic or Western perspective. What happens in kidney disease is the kidney starts not being able to hold all of the protein in the body, and more of that protein comes out. The way we can diagnose it is that there are certain tests that look at the enzyme, especially nitrogen, from the body when this starts to happen. The names of that are creatinine, BUN, SDMA, and also we always look at a urinalysis because in that urinalysis, the concentration in the urine will start getting more and more dilute, and the protein levels will start to rise.
Which you can see all of that if you get lab work done on your animals.
Correct.
Those values are usually going to be on the sheet that they hand you or the whatever they discuss with you.
That's correct. And the sooner that you do something about that, the better off it is. So that's why we really recommend our cats in their senior years get a biannual exam with their veterinarian and have lab work done, because this can change so quickly.
It can progress pretty fast.
So Jay knows that his cat is starting with this disease. Hopefully it's early on. What I like to do is, one, again, talk about getting them off of kibble. And the reason why I'll do that is kibble has a lot of inflammatory carbs in it, which create more and more inflammation, and we know that affects the kidney. So I tend to use, a lot of veterinarians will recommend, I mentioned other veterinarians work differently than I do, they'll recommend a kidney diet, one of the prescription diets. I'm not a huge fan of those diets. And the reason I'm not is usually the first ingredient is either corn or wheat, and it has a lot of carbs in there. They're specifically made to lower the phosphorus level, which I'm going to talk about in a second. And also they keep the protein low. But what actually ends up happening is in kidney disease, since they're, as we mentioned before, they're losing protein through the kidney. If you continue to make the protein low, guess what happens?
It's gonna get lower.
And what happens to the body?
It doesn't have enough protein. Are you gonna start losing muscle mass?
Yes. Olivia, dynamite. So I long ago started feeding regular protein diets through either freeze-dried, lightly cooked, fresh whole food. And I add a product called Azadil or Porous 1. These are products that bind nitrogen. So the cat can eat the same amount of protein, but that nitrogen isn't building up. So we don't see that higher creatinine, BUN, SDMA level, but they can still function on quality protein where they're not losing muscle mass.
That's so interesting. I didn't know about that.
Yeah.
This is so interesting.
I also use a product called Aminovast, which I've used for years. It's a supplement that increases what's called GFR, glomerular filtration rate, which is really like blood flow to the kidney, but it does it naturally.
And I have learned about this in class.
Yep. It's
What
hard
he
to say.
said. GFR.
GFR. So, and then the last thing I do is I put them on a phosphate binder. Often if the phosphorus level starts to rise, I'll use a product called Naraquin, which will bind the phosphorus in that cat. So now I have a cat that's eating its regular diet, but we're not worried about nitrogen because we're binding it with Azadil or Porous 1. We're using Aminovast, and these can all get incorporated right into the food. It's really nice. You're not forcing these to the animal. And then lastly, if the phosphorus level starts to rise, we can use this product called Naraquin, which will do that. And I have often seen these cats live numbers of years where those numbers haven't moved.
Perfect.
They're not losing weight.
That's what I want to hear.
They're not losing weight. They're not losing muscle mass, and it really seems to work well. So I hope that really helps you Jay. It really makes a big difference on a long-term basis to look at those types of things.
Thank you so much for sharing that.
Yeah.
That's so interesting to hear. And thank you, Jay, for your question. We love answering your guys' questions. If you have any, please feel free to comment them on the Instagram, on the YouTube, or at Dr. Randy's website. All of those can be found at Dr. Randy Pet Vet. And thank you guys so much.
And you can reach Olivia if you'd like also at Dr. Sacci.
Dr. Sacci has all of my vet school journey, all the crazy things I'm doing so far.
I love it. Well, it's fun to watch and it's fun to keep up with Olivia. So come back and we'll talk some more. Thanks for listening today, guys.
Thank you, guys.